Welcome to the September issue of the Journal of Vascular Surgery. We've selected 4 papers that highlight the September issue, and each is available free for the month. The first is an important paper entitled The Impact of Surgeon and Hospital Experience on Outcomes of Abdominal Aortic Aneurysm Repair in New York State by Meltzer and colleagues from Cornell. The authors used a New York State database to determine the impact of hospital size and physician volume and experience on morbidity and mortality of elective and ruptured aneurysms when repaired by both endovascular and open surgery. From 2000 to 2011, 18,842 patients underwent abdominal aortic aneurysm repair by a vascular surgeon. With intact AAAs, 26% underwent an open repair and 74% underwent an EVAR or endovascular repair, while for ruptured aneurysms, 64% underwent open surgery and 36% underwent EVAR. The authors concluded that for intact abdominal aortic aneurysm, the surgeon's volume was an important factor in open surgery repair outcomes, and low facility volume were associated with worse outcomes after EVAR. While for ruptured abdominal aortic aneurysms, low volume surgeons and low volume facilities had worse outcomes after open repair, but not after EVAR. The interaction between the surgeon's volume and the hospital volume is complex and varies based on the acuity of presentation and the treatment modality. The next paper by Christensen and colleagues from Denmark is entitled Metformin treatment does not affect the risk of ruptured abdominal aortic aneurysms. Based on the knowledge that diabetes has a protective role in the development and rupture of abdominal aortic aneurysms through matrix molecule accumulation, they hypothesized that metformin used for diabetes treatment, which reduces matrix molecule accumulation, may reverse the protective role of diabetes on the development and course of aneurysms. Using the nationwide Danish registry data, the authors identified 362 cases of ruptured abdominal aortic aneurysms from 1998 to 2013. 22% of the patients were long-term metformin users, compared with 29% of controls. They found a statistically non-significant but protective effect of long-term metformin use toward ruptured aneurysms. And therefore, the authors concluded that metformin use does not increase the risk of ruptured aneurysm among patients with diabetes. The editor's choice and CME paper for the month is entitled Racial Differences in Functional Decline in Peripheral Artery Disease and Associations with Socioeconomic Status and Education by Dr. Mary McDermott and colleagues. They conducted a study to determine whether Blacks with lower extremity peripheral arterial disease have a faster functional decline than white patients with PAD. Patients from Chicago medical centers with PAD were observed every 6 months for mobility impairment by doing a 6-minute walk test, and patients who are unable to walk up and down a flight of stairs. Of the 1,162 PAD participants, 26 were Black. Among the 711 PAD participants who were able to walk 6 minutes continuously at the baseline, Black race was associated with becoming unable to walk for 6 minutes continuously. This association was attenuated after adjustment for income and education. Among the 844 participants without baseline mobility impairment, Black participants had a higher rate of mobility loss, which was also attenuated after adjustment for income and education, as well as physical activity. The authors concluded that Black PAD patients have higher rates of mobility loss, and that these differences appear to be related to differences in socioeconomic status and physical activity. The last paper highlighted for the month is Current Practice of Thoracic Outlet Decompression Surgery in the United States by Reinhardt and colleagues from the University of Wisconsin. Since thoracic outlet syndrome and its management are relatively controversial topics, the authors reported on the current state of TOS surgery among hospitals that participate in the American College of Surgeons NSQIP, or National Surgical Quality Improvement Program database. Patients who underwent a first rib or cervical rib resection as their index procedure from 2005 to 2014, and whose constellation of diagnosis and procedural codes identified them as having neurogenic, arterial, or venous TOS, had procedure characteristics and 30-day incidence of specific complications, including nerve injury, reported. The authors identified 1,431 patients in the NSQIP database undergoing an operation for thoracic outlet syndrome, 83% for neurogenic, 3% for arterial, and 12% for venous TOS. Vascular surgeons performed 90% of the procedures. Only 0.3% of patients demonstrated any evidence of nerve injury, and the rate of bleeding requiring transfusion was also low at 1.4%. The risk was increased in patients with a higher ASA classification, those whose procedure was for non-neurogenic symptoms, and those whose procedure took longer to complete. The authors concluded that surgeons who advocate the surgical management of thoracic outlet syndrome and their patients can be reassured that such intervention is associated with an extremely low risk of disability resulting from iatrogenic nerve injury and major bleeding events. We hope you enjoy the JVS for the month of September. Thank you.